Hello, this is the introduction to attachment and bio-behavioral catch-up. So the first part is, what is the problem that's being addressed? The problem that is occurring in our society is the interaction between parents and their child. There's a lot of instances where the child is enduring some form of maltreatment and abuse, and it's causing negative parent-to-child interaction. And because of this, the child is becoming non-responsive to their parents and is causing problems toward their child development. It is believed that because the parent is not providing nurturing care and a negative environment, that the child is not responding in a positive way, and that is an issue in our society. So the reason why society and social workers should be concerned is that this is a growing problem in our society. Children who don't receive proper nurturing end up hindering their child development in the future, and it can alter their future. This is also a problem because children are either afraid, they're not responsive, and it might be due to the abuse that they're receiving. And as social workers, we are very caring, especially toward the children of our society, and we want them to grow and don't allow anything to hinder their child development. So we want them to have we want positive intervention toward them so they can grow and not have this social injustice hinder their future. The specific target population that we will be addressing there's two populations. One is the parents. The parents that are part of the target population are parents who have infant to young children up to the age of 24 months. And it could be parents or the caregiver, and there's a criteria for them. They could be high-risk parents who receive kids from foster care, and even grandparents. We believe that this population, if you start early in the child's life, we could help allow more positive intervention, more positive interaction between them. And the second group will be infants to young children from up to the age of 24 months. We believe if you start early, you could intervene and not allow the negativity to continue. And this is part one of our presentation.
So the model of intervention we'll be looking at is the attachment biobehavioral catch-up. We'll be focusing in on how this is used within the foster care system. This is a training program for caregivers to children who have been neglected, young children who have experienced early child abuse or neglect behave in ways that push caregivers away. So this intervention is intended to help caregivers provide that nurturing care and engage in interactions with their infants that provide secure attachment. These sessions are for 10 weeks. They're in the home for 60 minutes per session. The foster parents are provided with a parent coach. This parent coach provides in-the-moment feedback towards behaviors from the parent to the child. The frequent in-the-moment feedback focuses on the attention towards target behaviors. And along with these comments, those coaches provide video feedback to highlight the strengths, celebrate changes in behaviors, and challenge weaknesses. So this is a strength-based intervention. So as I previously mentioned, the sessions are for 10 weeks, and each session is outlined. Sessions 1 and 2 are designed to help parents reinterpret their children's behavioral signals. So this is basically looking into the patterns of behavior that the children display because the foster parent might not know their child's behavioral patterns. Sessions 3, 4, and 5 are designed to help those foster parents learn to follow their child's lead. Basically learning how to watch their children navigate through their world and to not bother them or to do something that might hinder their learning. Session 6 is designed to help caregivers recognize their own frightening behavior and develop alternative responses. So the foster parents might behave in a frightening way to the infant and may not know how to appropriately behave. So in the next slide, there's a video discussing what frightening behavior is and how it affects the infant, and how it is really important to learn their own behaviors so that they could adequately attach to their child. Sessions 7 and 8 are designed to help foster parents overcome those automatic responses to their children that are based upon their past. So this is kind of an example of how your past can shape your behavior. So if a foster parent has had a negative experience in the past with a child, they may act that same way with this child. And so they're basically looking on their behavioral patterns so that they could nurture the child and behave in a way that could provide attachment. And sessions 9 and 10 are basically to reinforce the knowledge that was given to them in the past sessions and to review everything that they had learned.
Not frightening. And so parents behave in frightening ways. I would say this is not a component that is there with our internationally adopting parents. We have this component with our neglecting birth parents, and that's where we added the component in. But after adding it in, we realized that this was also a very useful thing to have with foster parents. Foster parents are less likely to threaten in the same way as birth parents, but we still were finding people threatening in ways of, I would call your social worker, or you'd better not do that. And so we've added it into that intervention as well. But it's used for, I think, several reasons. One is certainly to control behavior, but a second is that sometimes parents are not aware that they are doing this. They're not aware that what they're doing is frightening, and so it often takes, in this case, showing videos over and over again so that they can see how it might have been frightening and what the child's reaction was. Now, the question is, why does frightening behavior matter so much? What is so problematic about this? Well, basically, as I said before, babies have no choice. They have to rely upon their caregiver. But when you have a caregiver that's frightening, you're sort of stuck. You're stuck between needing to go to that parent for care, but being frightened at the same time. Mary Main has talked about this as a dilemma without solution, that there's nothing you can do. It's interesting because people, not you, but people outside the field will often think that a child won't develop an attachment to a maltreating caregiver. That, of course, is not true. It doesn't make any sense to us. But it's striking that with rodent pups, Regina Sullivan and her colleagues have found that if you give a pinch to or a shock to a rodent pup during a particular postnatal period, what will happen is they'll actually show a preference for whatever is associated with that tail pinch or with that shock. So they are so geared toward needing to want to be with that parent that the system has to be built so that you will still connect to that parent even if they're hurtful to you. So that's a rodent example. We don't talk in terms of more or less attached from an attachment theory perspective. But the point is really, of course, babies have no choice. They have to have an attachment to this caregiver. So the problem is then what?
So as you can see, this video was presented by the founder and creator of the intervention, talking about parents' frightening behaviors and how it affects the infant. Before I go into the next slide, as a group, we would like to express how effective this program is. We saw the material and how the children who are provided with this intervention come out with secure attachments. And that's really important to know, because secure attachment provides a successful outcome in life, neurobiologically, emotionally, mentally, physically, all of it. And since this intervention is more for infants, it's an early prevention type technique. It intervenes right away to those children who are abused and neglected, and to help form those attachments, but it also is a prevention in having the outcome of the intervention be successful. It prevents later negative consequences. It really focuses in on every aspect of attachment, from how attachment is important in the infant's life and how it affects their brain. And the literature will say that it provides that secure attachment.
Is the program valuable and effective in the treatment of victims and their families? Creator of the ABC model, psychologist Dr. Dozier, stated that ABC intervention can prevent the development of a disorganized attachment when the intervention is in children under 2 years old. When she describes a disorganized attachment, she refers to long-term issues that can be seen into adulthood. Things such as an adult having trouble socializing or struggle in using others to co-regulate their emotions. It may also be difficult for them to open up to others or seek out help. In addition, she talks about a randomized clinical trial conducted with infants and toddlers. It was led by her and colleagues in 2006. These two separate studies indicated that children in the ABC program showed similar levels of cortisol in contrast to the typical development group. So when we think about if it's effective and valuable in the treatment of victims and the families, we can refer to these two variables: that it can prevent a disorganized attachment, and it can show improvement in the patterns of cortisol in children in foster care. What is the evidence that shows the ABC program as an effective intervention? Two independent samples suggest that ABC is effective in improving the attachment and helping regulate both biology and behavior in at-risk children. The two variables I'm going to talk about are maternal sensitivity and cortisol production. The evidence is based on children in foster care under 2 at the time of enrollment in the program. Changes in the maternal sensitivity and cortisol levels were observed. When the study talks about and refers to maternal sensitivity, they are talking about when a caregiver is able to notice, understand, and respond appropriately to the child's cues. Foster parents who receive ABC intervention showed a bigger improvement after the 10 weeks of the intervention. In addition, cortisol production was significantly different from those of foster children in the comparison intervention. This suggests that ABC could be effective in helping foster children regulate their biology in ways more characteristic of children who have not experienced early adversity. So when we talk about these two items, these two variables, we can see that there have been conducted different studies proving that the ABC intervention is effective. Where is the program being implemented and or tested? When we did our research online, we came across the Administration for Families, for Children and Families. They have a program called the Home Visiting Evidence of Effectiveness. They do a review of different programs. The ABC review stated that the intervention is being implemented in Delaware, Hawaii, Kansas, Maryland, Minnesota, New York, North Carolina, Philadelphia, and the United Kingdom. Moreover, when we did our bibliography, we came across the website of the University of Delaware. There they have the Infant Caregiver Project. This project is led by Dr. Mary Dozier, the creator of the program. She is currently looking for families with toddlers and families with children to participate in the program. So they are constantly testing and implementing the program to measure the effectiveness. How will we know if it's working? Studies by Dozier and colleagues have shown changes in the way foster parents react to distress behavior in foster children. What Dr. Dozier asks parents to do in the ABC program is basically three things: to nurture the child even when it's not illicit, to follow the child's lead, and not to be frightened. What she means by those three items is to be there for the child. Like, even if the child is crying and the parent just wants to fix the reason why, like to jump into the fixing mode, she says that she just needs the foster parent to be there for the child, to follow the child's lead, being aware of the cues about his or her needs and emotions, and not to be frightened at parenting, because children sense this fear and they learn from it. The program is based in short term, is 10 sessions, and each of the sessions are recorded so they can observe the interactions and changes in the parent, and most important, in how the infant starts to react to those cues and to those emotions.